Hello to my support fibro friends out there. I am jumping on to do this live stream. I was a little hesitant to do this because of the content, and hopefully I don't get blocked from social media for doing this topic, but we did post a video about maybe even a year ago on fibromyalgia and COVID-19 and just talking about the immune system in general and some precautions to take for fibromyalgia. There were a lot of questions in the comment section. And a lot of people are requesting for more information to do an additional video. So I'm doing this additional video with some hesitancy, but I'm encouraging all of you to create as much of a supportive community as possible. And hopefully the social media channels will allow this to be shared so that you can get the resources that you need regarding COVID-19, SARS-CoV-2, and what's going on, because there's a lot more information going on in the news media right now. So I just wanted to give you this information. Again, I'm a little bit hesitant to bring this up on social media, but please, 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 I encourage all of you to create a community of collaboration, of education. If you want to share and post your comments, I want this to be a safe space for everyone to learn from each other, and feel free to share. So if you do start getting negative in the comments, I'm going to have to delete you and delete your comments, no snarky comments. But if you have scientific information to share with the community and want to share different resources that you have found that can present science and just good quality information, please do share and post and say hello and where you're tuning in from. And I'll continue with, I'll start the video and the content as we go forward. I did want to mention that tomorrow we have our premiere interview on the fidget study for fibromyalgia. I am super excited for this interview tomorrow at 10 a.m. on our Support Fibro channels. It's a premiere. We were very fortunate enough to do an interview with Sharon Eardrish, and I hope I got that right. It's hard with Fibro Brain to sometimes get names correctly, but she's going to be talking about the fidget study for fibromyalgia and the work and the research she's doing in the microbiome on fibromyalgia. And we do talk about how we need more research in the fibromyalgia community when it comes to microbiome research. So I'm really excited for that opportunity. I hope everyone can hear me okay too. So I hope the audio is okay. For some reason, the audio got locked out when I can't update the volume, which is weird. Sometimes it does that on me. So it's like a natural update. But I wanted to just do that, make sure you tune in for that tomorrow at 10 a.m. and leave your comments, ask your questions, and please go support the research. There's a link in there. She is doing a crowdfunding campaign, so this is fantastic. This is a way to get involved directly with fibromyalgia research. We have a connection, and we're going to continue this as we go along with the Support Fibromyalgia Network. Okay, so let's dig into the content of this information, the video of just, again, going back through and talking about fibromyalgia in relation to what's happening now with COVID. And full disclosure, at the end, I'll get into more of my own experience with the vaccine, but currently right now, I know it's very prevalent as we talk about the Delta variant and what's going on with the Delta variant. I also have, this time around in the last month and definitely in the last few weeks, I personally have some family, loved ones who were hit with COVID and infected. I have one in particular who is in the ICU, and it's very heartbreaking. So I'm going to try to do this video and be as impartial with keeping that emotion out of this as we talk about the science and go into the other details. I would like to give a shout out to the Long COVID Alliance, Support Fibromyalgia Network, our partners with them. And I'm proud to be a part of this network. And I've been connecting with more long COVID patients and people that have the long hauler symptoms and have just continuously, once they've been infected with COVID, continue to have symptoms. It's very much of what we go through in the fibromyalgia community. Very much we can relate. My heart goes out to all of them as they are trying to maneuver through the medical system that you and I understand really well, and how dismissive it can be. So please go check out the Long COVID Alliance. There's a link in the description under the resources. So we are definitely one of the partner organizations. And you can see from the different organizations here that are involved, and we've attended a lot of the meetings, we've attended the working groups. So we are very proud to be here. I'm also working with some other health coaches in functional medicine. It's small, but we're doing just a volunteer group for long COVID patients in health coaching to at least provide them some functional medicine resources that they can utilize, because this is something new to them. Many of them were not managing chronic illness before, and now this is happening to them. So my heart goes out to everyone when it comes to this and what is happening now, and how your family and friends are being affected with this. I did want to mention too, I'd be interested to hearing from people, and you can post in this discussion or send a private message if that makes you feel more comfortable, is that if as a fibromyalgia patient, you did catch COVID and you having symptoms, maybe new symptoms, because I think one of the things I noticed, and I'm not clear of, as I hear from people with autoimmune conditions, people with fibromyalgia who got infected with COVID, and they're having the symptoms, or it created a flare up. But again, doctors are saying, oh, it's just your fibromyalgia, or oh, it must just be your autoimmune condition and you must be in a flare. But was something else happening there? Was it triggering the flare? Was that part of the sequence of it? Definitely be interested to hearing from all of you. Anyone with experience that feels like sharing, please do so. And again, we're really trying to create a safe space where people can communicate and share their experiences. So please be kind to each other when it comes to this. I know, again, I was hesitant to do this, but it's important. It's important that we get the right educational material out there, the right resources to people, because it's very confusing right now. Sometimes it can be sensationalized, and I'm getting a little aggravated at what I'm hearing in public health, what I'm seeing on other websites as well. So I just wanted to give this clarification as much as I possibly can, with impartial information, and be able to share resources with you, most importantly. So let's get on to some other resources that I've found that you might find useful. And so some of the things, like, I was really trying to get out of following mainstream media when it came to all of this information. So I just wanted to share a few of the YouTube channels which I've been watching and continuously kept watching, because it's not sensationalized. So it's really trying to dig into the science and explaining it in different terms. I have some other resources that I go to, like I do read up a lot on virology.org. I did a lot of research in college as a biomedical student, fascinated by virology. I kind of freaked myself out at the beginning of this, so I kind of took a pause, but the Delta variant, with it being so prevalent, has piqued my interest. So I went back to doing some of that research. So again, this is why I'm here learning, and just learning from these other resources, especially when we talk about the Delta variant and its increase in transmissibility, potentially increase in replication or viral load once it gets into your system. So for me, it's interesting to understand the science and the differentiation between the Alpha variant and the Delta variant. With itself can be confusing, because I know that there's a Theta variant that came into Houston. So I was looking at some of the news and the mutations involved with that. There's different variants, so even that can be confusing. So finding reliable sources is super important. So one of the resources I really gravitated to was Dr. John Campbell. And again, I posted all the links in the description. I know some of us are on Facebook and you won't be able to see maybe the links directly because of that, but I can't find a good resource necessarily to watch in Facebook directly, but if you have it, please share with everyone. Resources that maybe aren't mainstream media, but again, where they're breaking down the science, not sensationalizing the information, really giving an overall arching idea of what's going on based in the science. So I really like what he provides people. And I mean, it's been great, because you can constantly get this updates through the whole pandemic. And he really talks about, he is based in the UK. But I like how he breaks down the science. It's very well thought through, very presented. He presents the facts and figures of where we're at with cases and what to do when it comes to that, when it comes to other resources. And then I also like watching the MedCram and what he goes through. And it's actually fun. It's my alma mater of my school. So it was interesting of where he's based and who he treats, because I'm really I'm really enjoying listening from medical doctors who are also on the front line treating COVID as well in the ERs, and they've actually put together YouTube channels. So they're giving us a lot of good information of what's coming from them. So this is why. But if you have a resource like this, please share. It's super helpful. Another doctor I started following was Dr. Mike Hansen, again, based in, I believe, New York, and was on the front lines early on with COVID. So he was talking about it, and he goes through, and he has different videos that he also updates with more scientific information. So I like watching that as well. But if you have someone like this similar, that's not necessarily maybe our public health channels where people kind of aren't necessarily trusting of, but getting some more of this medical information out there, it'd be helpful to share those resources too. So those are a few of the resources that I've consistently watched because it doesn't irritate me when there's too much information. Oh, I think there's another one I left out, and I'll definitely post that later when it comes to getting information out from another medical provider. But sharing these resources that you can find helpful, you can dig into the information, because right now they are talking a lot about the Delta variant. They go through, as you can see from Dr. Mike Hansen's video, what a breakthrough infection looks like, talking about the different vaccines and information like that. And you can chime in into their comments as well, because other people are constantly, so you can read that information and learn from other people. But I do like these communities that they have also set up. For those of you asking questions about the vaccine, I just wanted to acknowledge that Health Rising put together this coronavirus side effects poll for ME/CFS and fibromyalgia, and the link is in the description. So you can go there, read the poll to understand more information on the vaccines and how people were feeling who took the vaccines. You'll also read about some hesitancy, maybe some other ideas to talk about with your doctor. So it's interesting how it breaks it down. I definitely would love to know more about some of the Johnson & Johnson vaccine results, which they opened up, but it gives a wide variety on the Moderna, the Pfizer, AstraZeneca, and it looks like they did add the Johnson & Johnson vaccine results. So this is a poll from his readers. So these are patients with ME/CFS and fibromyalgia. So you can get a sense of what's going on when it comes to, if you are wanting to learn more about the vaccines and the outcomes from people who've had the vaccine, who've taken the vaccine, if there's a lot of hesitancy involved, to get some of your questions answered, because I've been hearing from people that providers maybe aren't giving us the best answers when it comes to this. It's just either like, just do it and that's it, and you're looking for more information. So that was a huge question that came up in the first video. It was definitely about vaccines. Going to definitely point you to this resource to just look at the poll. And again, there's a lot of good comments in there of people talking about their experiences with the vaccine and the outcomes. I know there are people in here that did feel the effects of the vaccine. Some people started to feel better. I'd love to hear more about that. But feel free to share your experience. At the end of this video, I will talk about my own experience. But this is how you make an informed decision about your own health and what you need to do. Everyone here also knows I'm pretty big on finding the right mask and all of this information to you. If you have questions on masks and what you need with that, or finding something comfortable, I've added and continued to explore new resources. I even think I went to the Airband website, and they have a mask which has avocado oil in it. So I was going to give it a try. Maybe to like moisturizes the skin when you're wearing it. But I just nerd out on all that information, and I want to give everyone a safe space in the fibromyalgia community to ask those questions. I want to make sure that you feel protected, feel safe, and can come and make an informed decision about your healthcare in this space that we create for you. I did want to mention, because there's a lot of talk, and I was kind of annoyed. I still feel a little annoyed at some of the other chronic illness websites and where they put fibromyalgia in the category, because it hasn't been updated. And some of you have seen the latest research that came out about fibromyalgia reigniting the autoimmune discussion and the immune response in fibromyalgia. Whereas if you look at even some of the chronic illness resources in our very own community that got pushed out, they say right there that fibromyalgia is not an immune disease. But I think we really need to clarify and have disclaimers when we're talking about this information, because no one can guarantee what this looks like for fibromyalgia. And that's why I want to just put caution to the resources you're reading and spreading and information. And I really want to challenge some of the other chronic illness communities, because there are larger websites that we kind of utilize, and where the way they're describing fibromyalgia in that is kind of putting us in a very bad spot as far as this goes. So I would just like some clarity from them to just make a statement with us, like we don't know where fibromyalgia specifically lands in the category. It is confusing, and the latest research brings up again the autoimmune conversation. So when you have an immune response, and there was a study that says, fibromyalgia does not get severe COVID, but I called into question that, and even wrote some of the researchers about it, and they're like, well, we make no guarantees. But the research itself sounded so sensationalized that I had to dig in, and that's why I just wanted to point to this one. And I just wanted to make sure that there were people doing research to look out for us. There has been more research on fibromyalgia in relation to the effects of COVID-19. But this particular article, and again, it's in the description, you can link into that. They did want to make sure that people knew about us as a vulnerable population, because when information came out with underlying conditions like diabetes, cardiovascular disease, fibromyalgia, and ME/CFS were not mentioned. So people were getting doctors telling them that, oh, you don't have those underlying conditions, so don't worry. But this medical research and this article does come and really just talks about how we need to look out for this vulnerable population, because we are just not sure. And that's why I just want to take a look and just have this, if you need to show this to your doctor, because there's been some banter back and forth of disbelief, like, just don't worry, you're not going to be in that. This is stuff that we need to present. So in the midst of everything, it says, please do not overlook this vulnerable group. So I just wanted to bring up that piece of research too, of just, looking out for yourself and looking out for the fibromyalgia community. I am very protective of all of you out there. I want to make sure you have the right information, you protect and not get the misinformation. So that's sort of what I wanted to go into a little bit, and please share the information. I'm going to take a quick pause and address some of the comments that are come in. Donna, nice to see you. I know you're going to definitely watch later. Jason, has anyone had the shot? Okay, so Jason, I definitely want to point you to the Health Rising article, and then also some of the other comments. And if people have answers to this, definitely do. And so Jason, just to let you know too, from the Health Rising survey here, you can read through this poll and you'll get some of the information too when it comes to this, because there seems to be some people it took a lot longer. Like if you got the vaccine and you didn't have much of a response, some people didn't, and I'm not exactly sure why. And then other people in the community, the symptoms lasted maybe 3 months. Like they had the brain fog and other kind of symptoms of a flare up. And then also, as I mentioned, it's hard to tell, because people get dismissed so easily with the effect of what they're feeling versus when they went and talked with their doctor. A lot of people are saying, oh, it's just your fibro, or, oh, it's just the autoimmune disease. I heard this a lot in lupus. Oh, it's just your lupus flaring up. It can't be related to the vaccine revving up your immune system. So we don't have really good information. And I invite anyone that has a lot more clarity to this to have an open discussion, because it's important. I think there is a lot of dismissal going on in this world. And I'll kind of just open up too about my own experience. I took the J&J, the Johnson & Johnson vaccine at the end of March. I was hesitant because I've had a past history with having bad reactions to vaccines, and that happened to me in college. So I haven't really done, I was very hesitant to go, because I know my immune system tends to rev up just with even a mosquito bite. It waltz up, I get a huge histamine reaction. So I wasn't necessarily gung-ho about it. And I know there was a lot of pressure for a lot of us advocates out there to like be responsible and show your community what you deserve. So hard discussion to have. I did feel lingering effects. I still feel like a lot has been triggered in my hormones, and there is been research on this for people who are hormones, and that's what I'll do. I need to follow up with that research survey. I apologize for that because my hormones, I felt, got triggered. I kind of stabilized things and stuff started happening with the vaccine. And there's actually now been a lot of research being done with women getting the vaccines and hormone changes. Some people had not had their menstrual cycle or weren't having it or suddenly having it again. Other people, it came back stronger, and other people's it stopped. So it's interesting to understand the hormone. And I know if you talk to your provider, they'll be like, and I did the same thing. I asked my provider that question. They're like, no way. But there is research, and I will add that to the description because I was involved. I submitted surveys for that research because I fell into that category. So there is different stuff slowly coming out. So do your best to make an informed decision and it's risk benefit when it comes to this on what you may think. And nobody can tell you what to do in this situation, but we want to provide you a supportive environment to make the best decision you can for your health. And again, with this Delta variant, it is unique. It is different than the Alpha variant. It is much more transmissible. We are noticing an increase in viral load replication once it infects you. It seems like it's getting stronger, and we're waiting for more of that information because a lot of the information that's come out before, which we are docking on and some people are using, was still on the Alpha variant, and it is changed. So we need the data and the information on the Delta variant, how it relates to the vaccine efficacy, how it relates to people with autoimmune conditions. I was on a Clubhouse today, and I'm learning from the Johns Hopkins studies in people enrolled who are severely immune compromised or taking immune suppressants. They're not building the antibodies. So I'd like to maybe bring in Christine at some point to talk about it because she did get the 2 doses of the vaccine and she has not built the antibodies that she needs. So her doctors are concerned about her traveling and being in public places with a lot of people. But we need to have these discussions as we move forward. Thank you, Katie, for being brave and chiming in as well. So Katie shared her experience with the Pfizer. Thanks, Katie. I'm still like, it's hard having these discussions because we don't want people to get negative, and just sharing the resources. And as much as I do appreciate what some of our public health initiatives are doing, or people that give the resources from the CDC, I am looking for additional resources that people can kind of feel are more like us, relatable in that sense, and build that trust with. So that's kind of why I shared some of those YouTube channels. I like the way they share the facts and information so we can learn more and just understand, because it's so confusing. It is really confusing. As a person that digs into science and loves science, especially virology, I can't imagine how confusing it is. And if you are confused, please reach out. Let us know how we can support you. There are some good resources we can send you to so you can make a better informed decision for your own health as we move forward. Definitely continue to protect yourself as you need. I know with fibromyalgia, like I said, we don't get proper sleep. We deal and manage with a lot of stress that affects our immune system. So our immune response, and we know this, right? We hear it when people talk about immune health, sleep, stress reduction, nutrients, getting the proper nutrients. Many of us are deficient in vitamin D, which we've seen related to discussions in COVID. So, protecting, building your immune system, if anything, can take care of that. But please just be kind to each other in the conversation. Share your experiences with the vaccine if you feel comfortable doing so, or if anyone wants to ask questions privately, I'd be happy to answer. I do want to say that I'm not a medical physician. I'm a health coach working with fibromyalgia, autoimmune, and long COVID patients in group coaching settings, but it's a little different, focused on functional medicine, lifestyle behavior changes. We don't give supplement suggestions as like those, but I'd be happy to open up a biohacking course, if someone's interested in that. But please take care of each other. Keep the information flowing. If you have a good resource, or you want to be the devil's advocate on the other side and share some good information based in science, please do share the articles with each other so we can gain as much knowledge as we can. Go check out the Health Rising poll to learn from each other. Those other resources that I said with YouTube have good communities. Majority of the time, I think a few bad comments kind of sneak in there, but they have good responses, so you can learn from these providers, and sometimes they actually respond back. I've posted some comments on the YouTube channels, and they've actually gotten back to me with a really detailed response, so I appreciate that. And then tune in tomorrow for the fidget study. Again, we're going to be talking about the microbiome with fibromyalgia, how there's a need to do more research with fibromyalgia when it comes to the microbiome. I'm so excited about her research because we go into studying the microbiome, the oral biome, so the oral health, which has become huge just in general research for brain health, cardiovascular health. So she wants to get into more testing when it comes to that. Also, urinalysis for histamine. She really believes there's a connection there. So I geeked out. I wish we're going to probably have to have her back, but I'm excited to have more researchers on board. I love talking with science. And if you love it too, definitely let us know. Please keep in touch with us, like our page, share with your friends, let them know what Support Fibro is doing. We're going to have a lot more information coming up. I've just been taking a little bit of a pause. Like I mentioned, I have some very, very close loved ones who are really sick with COVID. One is in the ICU. So it's affecting me emotionally, but we keep on going. That's why I thought it was important to kind of check in with everyone, make sure you had a safe space to talk about this as we go through this all together. I know I was really looking forward to the end of the retreating as people opened up. I am in Los Angeles County, so it does bear down on us with changes coming in. There's a lot going on. So take care of yourselves, take care of your friends and family, and see you tomorrow for the premiere video. Bye.